So I want to talk about the clock test, or what is referred to as the clock test when it comes to dementia. So let me illustrate with one particular client patient I had. And this was an individual who was driving around, was playing golf, enjoying time with their spouse, and basically doing everything, almost everything. I guess they started having problems in their work because high-powered financial in the finance field, having to do all those calculations and not being able to do those things, I guess that kind of pushed them into an early retirement. But like I said, they were driving, they were doing everything, almost everything, with some limitations. So what I usually do with my patients is I have them sit down and then do what is called a clock test. And basically, it simply means you give them a time, like 10:40 a.m., and have them draw the clock, not the digital clock, obviously, but a full face of clock with the numbers and then the minute sign, the minute hand, the hour hand. Forget about the second hand, but the minute hand and the hour hand, and see, just observe them. Don't give them any other cues. Their spouse can't help them, and have them draw it out and specify the time. And of course, any normal functioning individual would be able to know that 12:30, for instance, or 11:40, the hour hand cannot be on the number 11, for instance. It's going to be somewhere between 11 and 12, and so on and so forth. Almost invariably, what I find is that individuals cannot do it. Sometimes the numbers are all skewed up, or the numbers are outside the circle, or this is all jumbled up, or they have a lot of trouble getting to it. And sometimes they get it right. They eventually get it right, but they struggle. So it's a really an interesting test, because it tests, because you would think that most people will get it right, at least people functioning normally the way I said this individual was functioning. But it's alarming how many people who are beginning to have cognitive problems or memory problems are not able to do that. But that's something you can try at home with your spouse or your loved one. If they're complaining about memory loss or cognitive issues, one way to, if they're not going to go to the hospital to do any real elaborate tests, then you can start there and say, well, try doing this, and then see how they do. So that's a tip. Hope you take advantage of it. Take care. Bye.